All right, so limited hip adduction is what we are looking at. So we have actually called limited hip adduction so many times, but we're talking about issues in the hip and all of that. So what we just want to like talk about is, so what could be the things that could make your hip movement to be limited? Abduction just simply has to do with you are spreading something apart. Yeah, adduction, you are bringing it together. So of course, what could make the leg not want to go apart so much could be that maybe there's a problem underneath. Do you understand? So you just have to do with possible problems that could make your hip not want to like go apart. So you can call it what difficulties in spreading the leg sideways. All right, so it's not a disease condition by itself. When you see it, it only shows that there is a disease condition that is what underlying. You understand? All right, so it could be the hip joints directly affected, it could be the muscles affected, it could be the tendons affected. So it's especially important in infants and toddlers, all right, where it signals that there's some developmental concerns. So what is hip abduction? It's a movement of leg away from the midline of the body. So if this is a midline, if you are moving this leg this way, that's abduction. If I'm moving the leg back, that's adduction, right? So this is limited. So the movement of the leg away from the midline is controlled by muscles like gluteus medius, gluteus minimus, the tensor fasciae lata. All right, so possible causes, what could make, which is the height of this lecture, right? What could make your hips not want to go away? All right, so trying to know how the hip is going away and back is what is known as a what? Ortolani and Barlow test. We have already spoken about them. So it could be that you have muscle dysfunctions. So the muscles that are involved in taking this hip away and back, they are affected. It could be developmental issues, it could be neurological issues, it could be joint pathology, it could be soft tissue problems, it could be postural imbalance. So for each one of these, you can pause to look at their examples. You understand? So a lot of things could actually make your legs not want to move away and back and understand. So signs to watch out for is if the same person is having limping and waddling gait. You understand? Or when you are putting diapers for your baby, just notice, are the legs moving very well and back? If the hip is stiff or there is pain, all right, pelvic drop during walking, one leg appearing shorter than the other one. You understand? So you see, even for adults, they do this. You understand? So diagnosis and management is for diagnosis, of course, this is physical examination. You understand? I want to actually visualize a lot, moving and all of that. So imaging is because you want to see the inside, you want to pick up any issues occurring inside. So treatment, physical therapy is because you want to strengthen the abductors. You understand? Then stretching and mobility exercise, you use drugs like corticosteroids because you want to tackle the inflammation coming up. Surgical intervention in cases that are actually getting so severe. Okay.